Joining TV47, you're just in time for 4 p.m. news now with I, Sheila Chelangat, as I get you informed on what is happening in the world of news. We begin where the Director General at the Ministry of Health, Patrick Amoth, has assured Kenyans of a sufficient stock and supply of ARVs and HIV test kits in the country for at least 6 months following the U.S. government threat to hold any financial aid globally to the WHO. Speaking during the press briefing, Amoth has also revealed that 98% of Kenyans are aware of their HIV status and that they are on treatment. However, he has also revealed that the country is still lagging behind in terms of viral suppression, which is at 94% as compared to the 95% of the global target.
We are all aware of the numerous executive orders issued by President Trump, including the latest regarding development support to halting development support to the rest of the world. The U.S. government is the largest single bilateral donor globally. In 2023, the U.S. government contributed a whopping $72 billion as development aid to the rest of the global community. Kenya and the U.S. government have had a very strong bilateral relationship, and therefore we are cognizant of information emanating from the U.S. government. But I want to assure Kenyans that we have sufficient stocks of HIV commodities, be it antiretrovirals, be it the testing commodities. We have strengthened our supply chain pipeline in the last 1-2 years to ensure that at any given time we have more than 6 months of stock. We are told globally as a best practice that if you run a big program like the one we run, where we have nearly 1.4 million Kenyans on treatment, then you must be able to ensure that you have your plan B to be able to address any contingencies that would arise either deliberately or out of events outside your control. Out of this, therefore, we can be able to report a very strong and successful program, nearly about 1.4 million persons on treatment, and we are on target in our 95 global targets, meaning 98% of Kenyan population know their HIV status, and out of those who know their HIV status, again, 98% are on treatment. We are lagging behind in terms of viral suppression slightly. We are at 94% against a global target of 95%. And one of the biggest contributors to our failure to achieve the 95% in viral suppression is in regards to elimination of mother-to-child transmission of HIV. I want to appeal again to all members of the community, family members, to ensure that those who are on treatment go to the facilities to be able to receive their medications, because we have the medicines and the healthcare workers to be able to provide that service. Again, in terms of ensuring seamless service delivery, our prescription pattern for antiretroviral therapy is that we give you 3 to 6 months of medicines. So nobody should be able to miss their medication despite what is happening out in the global arena. That is for us to be able to discuss as technical experts. Our role is to ensure that we shield the patient who requires treatment and ensure that they continue to receive the treatment uninterrupted. As a result of that, at programmatic level, we have directed that the programs dealing with these critical strategic programs to be able to get weekly reports from the counties on service delivery, including ensuring that patients receive the services, the testing services continue, the antiretroviral drugs are available and are provided, and ensure that no Kenyan who is in need of treatment misses. And that should be our clarion call, that whatever is happening in the global arena is part of this discussion that have been ongoing for a period of time except now it has been brought to the forefront. What we need to ensure is that we continue to get our patients to receive their medication.